In a world where emergencies can strike at any moment, being equipped with basic first aid skills is not just a valuable asset, it's a vital necessity. From a simple cut or bruise to more serious incidents like cardiac arrest or choking, knowing how to respond promptly and effectively can make the difference between life and death, or between a minor inconvenience and a serious health issue. First aid encompasses a range of techniques designed to provide immediate care in various situations, from treating minor injuries to handling critical emergencies. It involves assessing a situation, providing initial treatment, and knowing when to seek further medical assistance. Whether at home, at work, or in public spaces, these skills enable individuals to act with confidence and compassion during unforeseen circumstances. The importance of first aid training extends beyond the immediate act of providing care. It cultivates a proactive mindset, enhances personal and community safety, and empowers people to handle emergencies with composure and effectiveness. This introduction to basic first aid will explore essential skills such as treating wounds, administering CPR, and managing other medical emergencies, equipping you with the knowledge needed to respond to a wide array of situations with competence and care. Understanding basic first aid can be a life-saving skill. Whether it's a minor cut or a more serious medical emergency, knowing how to respond effectively can make a significant difference in the outcome. This comprehensive guide will cover essential first aid practices, including treating wounds, administering CPR, cardiopulmonary resuscitation, and managing other common emergencies. Before providing first aid, ensure the scene is safe for both you and the victim. If necessary, call emergency services immediately. Clean the wound with water, apply an antiseptic, and cover it with a sterile bandage. Apply direct pressure to the wound with a clean cloth or bandage. Elevate the injured area if possible. Do not remove any objects stuck in the wound. If bleeding doesn't stop, seek emergency medical help. Once bleeding is controlled, clean the wound with water. Avoid using alcohol or hydrogen peroxide directly on the wound as it can cause tissue damage. Apply a sterile bandage or dressing. Signs of infection include redness, swelling, warmth, and pus. If these occur, seek medical advice. Gently tap the person and shout, "Are you okay?" If they do not respond, call emergency services immediately. Tilt the person's head back and lift the chin to open the airway. Look, listen, and feel for breathing for no more than 10 seconds. If the person is not breathing or breathing abnormally, proceed with CPR. Place the heel of one hand in the center of the chest, between the nipples. Place the other hand on top and interlock the fingers. Push down hard and fast, at least 2 inches deep at a rate of 100,120 compressions per minute. Allow the chest to fully recoil between compressions. After 30 compressions, give 2 rescue breaths. Pinch the nose, cover the person's mouth with yours, and blow into their mouth for about 1 second each, making sure the chest rises. Continue with cycles of 30 compressions and 2 breaths until emergency help arrives or the person shows signs of life. Perform the Heimlich maneuver. Stand behind the person, place your arms around their waist, make a fist with one hand, and place it above the navel. Grasp your fist with your other hand and give quick, upward thrusts. Place the infant face down on your forearm, supporting the head and neck. Give 5 gentle back blows between the shoulder blades with the heel of your hand. If not relieved, turn the infant face up and give 5 chest compressions using 2 fingers. Cool the burn under running water for 10-15 minutes. Cover with a sterile, non-stick bandage. Avoid using ice, butter, or ointments. Call emergency services immediately. Cover the burn with a clean, dry cloth. Do not remove burnt clothing stuck to the skin. Immobilize the injured area. Use a splint if available. Apply ice to reduce swelling. Seek medical help immediately. Follow the RICE method. Avoid using the injured area. Apply ice wrapped in a cloth to reduce swelling. Use an elastic bandage to compress the area. Keep the injured area elevated above heart level if possible. If the person has swallowed poison, do not induce vomiting. Call poison control or emergency services immediately. Provide information about the poison if known. Remove contaminated clothing and rinse the skin with water for at least 15 minutes. Move the person to fresh air immediately. Seek medical help if symptoms persist. Move any dangerous objects away from the person. Place a soft cushion under their head if possible. Do not restrain them or put anything in their mouth. Let the person rest. Provide comfort and reassurance. Seek medical advice if it's their first seizure or if it lasts more than 5 minutes. Basic first aid knowledge empowers individuals to take immediate and effective action in emergency situations. By understanding how to treat wounds, administer CPR, and manage various medical emergencies, you can help save lives and reduce the severity of injuries. Remember, while first aid can provide crucial initial care, seeking professional medical assistance is always important for comprehensive treatment and evaluation. By practicing these skills and keeping updated with first aid training, you can be better prepared to handle emergencies and provide essential support until professional help arrives. Mastering basic first aid is more than just acquiring a set of skills. It is about fostering a sense of responsibility and preparedness that can profoundly impact the lives of those around you. The knowledge and application of first aid principles not only equip you to manage everyday injuries and emergencies but also instill confidence in handling situations that could otherwise be overwhelming. First aid training offers crucial benefits beyond the immediate application of techniques. It enhances your ability to remain calm under pressure, make quick decisions, and act effectively during emergencies. With practice and familiarity, you can become a reliable presence in critical moments, providing comfort and crucial support until professional medical help arrives. The principles of first aid are built on fundamental concepts: assessing the scene for safety, delivering timely intervention, and understanding when to seek additional help. Each component, from wound care and CPR to handling more complex emergencies, relies on a foundation of accurate knowledge and practical application. The skills you acquire through first aid training can bridge the gap between a medical crisis and effective professional care, potentially saving lives and minimizing long-term damage. Having a community where individuals are knowledgeable in first aid creates a safer environment for everyone. In schools, workplaces, and public spaces, the presence of trained first responders can make a significant difference. When more people are equipped to manage injuries, perform CPR, and handle various emergencies, the collective resilience of the community is strengthened. This preparedness not only enhances safety but also fosters a culture of care and readiness. Furthermore, first aid training promotes a proactive approach to health and safety. It encourages individuals to be observant, to learn how to prevent common accidents, and to react swiftly and effectively when accidents do occur. The skills learned through first aid courses can also lead to better health outcomes by addressing injuries promptly and appropriately, potentially reducing the severity of conditions and complications. It is crucial to recognize that first aid is not a static skill but one that benefits from regular practice and updates. Medical guidelines and techniques can evolve, and periodic refresher courses ensure that your knowledge remains current and relevant. Engaging in hands-on practice and staying informed about new developments in first aid can enhance your confidence and competence. Moreover, integrating first aid knowledge into everyday life involves more than just applying techniques. It encompasses a mindset of vigilance and readiness. By being attentive to safety hazards and understanding the importance of immediate care, you contribute to a safer environment for yourself and others. Encouraging friends, family, and colleagues to participate in first aid training can amplify the positive impact on your community. Sharing knowledge and experiences fosters a culture of preparedness and support. Additionally, engaging in first aid training as a group can strengthen team dynamics and enhance collective readiness for emergencies. Ultimately, the ability to provide first aid reflects a commitment to safeguarding health and well-being. It is an expression of empathy and responsibility, demonstrating a willingness to take action when it matters most. Whether responding to minor injuries or serious emergencies, the skills and knowledge gained through first aid training are invaluable assets. In summary, basic first aid is a vital component of personal and community safety. It empowers individuals to act decisively in emergencies, contributes to overall public health, and fosters a culture of preparedness. Embracing and continually refining these skills not only enhances your ability to respond effectively but also strengthens the collective resilience of your community. By investing in first aid training and encouraging others to do the same, you play a crucial role in creating a safer, more prepared world.